My name is Margaret Eaton, and I'm the National CEO for the Canadian Mental Health Association, and it's my great pleasure to be here today to launch ACT for Mental Health. Founded in 1918, the Canadian Mental Health Association is the most established, most extensive community mental health federation. We're in 330 communities across 10 provinces and the Yukon. And we provide advocacy programs and resources that help to prevent mental health problems and illnesses, support recovery and resilience, and enable all Canadians to flourish and thrive. As someone with lived experience of mental health issues, including anxiety and depression, I'm very proud today to bring the voices of frontline community mental health and substance use health service providers and the clients they serve to Ottawa today to launch the Act for Mental Health campaign, an advocacy campaign supported by a broad coalition of over 30 organizations, including, and most importantly, the voice of those who live with mental health and substance use concerns. I'm so proud that the coalition includes the Canadian Psychological Association, the Canadian Psychiatric Association, the College of Family Physicians of Canada, CAMH, the YMCA and YWCA, the Canadian Centre for Gender and Sexual Diversity, the National Right to Housing Network, and many others. Today, the CMHA and our coalition, representing the millions of Canadians we serve, are calling on the government to create the promised Canada Mental Health Transfer in the next federal budget. Canadians are proud that our universal healthcare system looks at our need for care and not our ability to pay. But our healthcare is not universal at all, especially where mental health is concerned. Under the Canada Health Act, mental health care is only covered by public health insurance when it's provided by physicians and hospitals, and that is just not enough. I want to tell you a story. It's Jane's story, and it happened a few weeks ago. Jane is 52. She's a lawyer in Toronto, and she has a mental illness. Her job is stressful, and the pandemic has made it even worse. She's been waiting for a psychiatrist for more than a year. Unable to withstand her suffering, she took an overdose of medication. But thankfully, there was someone there who got her to the emergency room, and she was able to survive. But now she's in hospital in a mental health unit. Her husband and their 2 teenage children need help urgently. They need a social worker, family counseling, and individual counseling. Once discharged from the hospital, she and her family will need a community of support, ongoing care, so that they can all be well again. Her husband is resourceful, but he's not sure how to get this kind of care, or even if it exists. He is terrified. When someone is in a mental health crisis, all roads lead to a hospital, but we need to step in before there's a crisis. Emergency departments aren't the cure for mental health system failure. We're also failing people once a crisis passes. Often they're discharged without the care they need because it either doesn't exist or it isn't covered. With rising mental health care needs and emergency departments stretched past their limits, Canada must act now to cover mental health care both before and after people are in crisis. At a conservative estimate, we're paying over $1 billion each year on private psychological services alone. While some free mental health and substance use health services exist, persistent underfunding to community-based agencies mean wait lists are long and services are limited, particularly in rural Canada. When we can't afford to pay, often we don't get the care we need, which can lead to crisis and to the emergency department. In a time of rising cost of living, Canadians shouldn't have to choose between rent, food, and therapy, especially when we know that poor mental health costs our economy $50 billion per year. This is despite knowing that every dollar spent on mental health returns $4 to $10 to the economy in increased productivity and reduced healthcare costs. The government has promised major investments in mental health, but we have yet to see real action. They need to act now to cover mental health and substance use health care. We all have the right to care that is publicly funded. It's not just the right thing to do. Research shows it's the smart thing to do, and we can't afford not to. This is a call to action. Join us. Beginning today, our coalition is calling on Prime Minister Trudeau, Deputy Prime Minister Freeland, Minister Duclos, and Minister Bennett to create the Promise Canada Mental Health Transfer in the next federal budget, with an annual investment of $5.3 billion, equivalent to 12% of provincial and territorial health expenditures, with 50% earmarked for community-based services. Visit actformentalhealth.ca to send a letter to the Prime Minister. Jane and her family and millions of Canadians need universal mental health care, not next year, but now. I'll now pass the mic over to my colleague, Leora Simon.
Hello, my name is Lior Simon, and I am the chair of the National Council for Persons with Lived Experience, and I also sit on the board at the Canadian Mental Health Association. Our council is an advisory committee composed of volunteers with lived or living experience of mental illness, working to ensure that the voices and needs of people with lived experience guide CMHA's focus and work. My first brush with the mental health system came when I was hospitalized for the first time on the psychiatric ward at the age of 15. Over the next few years, I cycled in and out of the hospital. If there were community services available, neither I nor my family was aware of them. For me, hospitalization was extremely traumatic. I only really began to heal when I started intensive psychotherapy with a private psychologist. I was incredibly lucky to find a therapist that I could trust and worked well with, and truly extremely privileged to have been born into a family that could afford to cover the costs of care with the help of my father's insurance. I would not be where I am today without that support, and there is no doubt in my mind that my success and recovery would not have been possible without access to those resources. Without my parents' financial support, I would have ended up on unemployment or disability, which do not provide enough money to cover the basic needs of life, let alone private psychotherapy. When I see people with mental illness who are homeless, living in poverty, I know that could have been my reality. The opportunities I had to recover and succeed should not be a privilege. Like me, many of my council members have directly interacted with the mental health system, and we know firsthand how broken it is. We know where the holes are, and we know it needs to be fixed. Many of our other members, both past and present, feel lucky to have received care when they did, even if it took months to get, or it wasn't really the care that they needed. In the past few years, we have often heard people speak about the month-long delays, causing symptoms to worsen and illness to progress. Many members waited years to see psychiatrists, hoping they would be a good fit, because choice in this system is an unheard of luxury. In the meantime, they would often end up in the emergency department because there were no other options. For most of my fellow members, as for me, access to community-based supports have been minimal and hard to access. The emergency department is like a revolving door. You enter in crisis, get urgent care, then you are often discharged without any follow-up or a long-term support plan, only to end up back in the ED. Those who are homeless are often discharged to the street. Healthcare providers know this is not a solution, but they too are faced with the limitations of our system. Finding a provider who will provide culturally safe, appropriate, and stigma-free care can take a long time and requires trying many different providers. Even when we can pay for private care out of pocket or have the limited insurance to cover these costs, it's almost impossible to find the right provider with the money we have. Negative experiences can make us less likely to seek out care in the future and make us wary of trusting providers, even when we really need the help. To this day, I am still wary of new healthcare providers due to my own negative experiences when I was forced to continue treatment with providers that cause more harm than good. Without community supports, it is easy to fall through the cracks. The system makes you feel helpless, like you're on your own, left to figure out who to go to, where to turn, how to get there, what it will look like, what difference it will make, what medication to take, and above all, how to afford it. Many people with lived experience feel abandoned, left to fend for themselves until the next crisis. if they survive that long. It shouldn't be like this. It doesn't need to be like this. My vision for the mental health and substance use health system is for it to be available to everyone, wherever and however they need it. It's that simple. The Act for Mental Health campaign is about making mental health and substance use health care universal. Until services are publicly funded and available to all, we are pretending that our healthcare system is universal. Thank you. I will now pass the microphone to my colleague, Marion Cooper.
Thank you. My name is Marion Cooper, and I'm the CEO for the Canadian Mental Health Association for Manitoba and Winnipeg. CMHA Manitoba and Winnipeg serves the needs of all Manitobans, young and old, through a variety of services and supports. Our mission is to promote the mental health of all people in Manitoba and to support the resilience and recovery of individuals experiencing mental illness and substance use disorders. The Manitoba mental health and substance use health system has been underfunded for decades and continues to struggle to meet the growing needs of Manitobans. Wait lists are often long with the formal healthcare delivery system, and community mental health organizations are deeply underfunded. Navigating the system is challenging and often services are poorly coordinated. Emergency departments are often the first point of contact, as we've heard, when an individual is experiencing a mental health crisis. These environments are not equipped to respond to the mental health issues in a trauma-informed way. Crisis response services are often overwhelmed and struggle to have the right quick access to the array of interventions required to meet the ever-growing complexity of needs of individuals and families, such as acute meth addiction withdrawal. Manitobans who are unsheltered are gearing up for another cold winter. And although there have been significant investments through Reaching Home, once again, we need the resources to be growing and continuing to grow to respond to the complexity of needs that go beyond just providing shelter, but really responding to the root causes of homelessness. Substance use treatment programs are often out of reach for many people, as these services require fees and are not universally accessible or have long wait times, often missing that moment of readiness. Employment supports for individuals who've experienced a mental health or substance use health issue challenge are not broadly available. In many cases, tailored mental health employment services, if funded appropriately, are poised to really support people to take the next step in their recovery and enter the workforce. Our experience in Winnipeg and across Manitoba is mirrored across the entire country. We interact with a system of patchwork programs, services, and supports offered by private, public, and not-for-profit agencies. This makes for a very confusing and hard to navigate system that leaves people without care that they need. It really isn't a system at all, and it's often not very caring. It's hard to figure out how and where to get the help in our mental health system. And even if you find it, you may have to pay out of pocket or suffer on long wait lists. Organizations like CMHA do provide some supports around service navigation, but these aren't at the scale that are required in our communities. Despite delivering evidence-based life-saving services that all people have a right to, community-based mental health agencies and organizations piece together small pockets of funding from various sources just to make ends meet. This often means that we can't meet the rising demand for mental health supports in our communities. And this demand and this complexity continues to grow, especially in the face of emerging crises like the pandemic and the complexity of our system trying to transform and figure itself out. The impact of the pandemic has been enormous. It's upended the access points for many basic needs services such as income supports and food security. Long wait lists for intake appointments for basic social assistance, people left behind feeling isolated, disconnected from the help, continues to be a challenge. And although we've seen many positive things with virtual care, often people feel more disconnected as they're trying to find the resource to support themselves. Employment services, income assistance, housing, mental health care, these are all critical ingredients to a comprehensive community-based mental health system. And of course, that system will only thrive when we have a workforce that's able and ready to respond. Operational demands on staff has made retention and burnout a real and ever-present challenge in many organizations. We know that investing in community-based mental health care is not only the right thing to do, it's the smart thing to do. Counseling and psychotherapy, harm reduction programs, recovery-oriented addiction services, peer support, youth outreach services, employment and housing, income supports, and food security all have high returns on investment. We also know that mental illness prevention and mental health promotion services, suicide prevention, and mental health literacy programs significantly ease the burden on the acute care system by reducing hospitalizations and healthcare costs. And our healthcare system is in need of that support right now. Act Now for Mental Health wants to right the wrongs in the Canadian Health Act by urging the creation of the promised Canada Mental Health Transfer that would fund these missing services, accompanied by a new Canada Mental Health and Substance Use Health Act that would make the transfer permanent and transparent. This is so needed in all of our communities from coast to coast to coast. Doing so would ease the strain on the acute care health system, reduce hospitalization, provide options beyond emergency departments. We need care before the crisis continues and grows even larger, and we need a system that actually works like a system. Thank you. I will now pass the microphone on to my colleague Debbie from the Center of Gender and Sexual Diversity.
Thank you. My name is Debbie Owusu-Akyeeah, and I'm the Executive Director of the Canadian Centre for Gender and Sexual Diversity. CCGSD works to empower gender and sexually diverse communities and young people through the service areas of education and advocacy. We are guided by the goals of the communities in which we work and are committed to ensuring that all people and communities have access to education, healthcare, shelter, and food, among other rights entitlements. We are proud to be part of a nationwide coalition of diverse organizations collectively advocating for mental health and substance use health systems change. Access to mental health and substance use supports and the social and economic conditions like housing, income, and food contribute to good mental health. These are not only rights entitlements, but central to addressing the barriers that prevent marginalized and oppressed individuals, peoples, and communities from participating fully in society. The COVID-19 pandemic highlighted and made worse inequities in our societies. The mental health of 2S LGBTQ folks has been particularly impacted. Research we conducted during the pandemic showed that 93% of 2S LGBTQ+ youth respondents we surveyed struggled with their mental health. Mental health concerns cited most often included feelings of depression, isolation, and loneliness. The pandemic brought about social isolation, further limited access to community supports, and created safe environments for many 2S LGBTQ+ folks and women. 2+ years in, our healthcare system and emergency departments in particular strain under rising pressure. This has only worsened the structural inequities that lie at the heart of poor mental health and substance use concerns. Colonialism, racism, sexism, and ableism permeate our healthcare systems, policies, and investment mechanisms, all contributing to barriers in access to care and poor health outcomes. The ongoing lack of access to culturally appropriate and safe mental health and substance use care has harmed and continues to harm Black, Indigenous, people of color, immigrant, 2S LGBTQ+, and low-income folks in particular. Many will cycle through hospitals, shelters, and the criminal justice system without getting the help they need. Our social locations intersect with mental health and substance use concerns, resulting in increased risk of experiencing homelessness, income insecurity, violence, and harassment. Our health, justice, housing, education, and social systems must be transformed to better meet the needs and realities of diverse communities. It means taking an explicitly anti-racist and anti-oppressive approach to policymaking and service delivery. Closing gaps in access and addressing systemic discrimination requires diverse people with lived and living experiences of mental health illnesses and substance use health concerns to be included in a meaningful way in the system's change work. It means investing in culturally appropriate, community-based supports that prevent mental illness and promote good mental health, like social and emotional learning and mental health literacy, alongside housing, income supports, food security, and the decriminalization of drug possession. Community-based organizations doing this work have been systemically underfunded, yet are at the front lines of providing life-saving, culturally safe, and appropriate, free, and accessible care to those experiencing multiple and intersecting forms of discrimination and inequity. We support ACT for Mental Health because we believe that mental health and substance use health care should be funded publicly as a right and free to everyone, wherever and however we need it. We firmly stand behind the creation of a Canada Mental Health and Substance Use Health Transfer that would provide long-term, sustainable core funding to community-based organizations to deliver health and substance use health supports. Thank you. And I'll pass on the microphone to my colleague, Michelle.
Hello, my name is Michelle Biss, and I'm the National Director of the National Right to Housing Network, a group of over 1,000 organizational partners, academics, advocates, people with lived experience of homelessness, with a mission to fully realize the right to housing in Canada. The historic National Housing Strategy Act, or the NHSA, was adopted back in 2019, and it reaffirms Canada's international obligation to the right to housing and commits the Government of Canada to implementing housing as a fundamental human right through its programs, policies, and budgetary decisions. The rights-based approach that's outlined in the National Housing Strategy Act mandates that federal investments in housing programs and policies use a maximum of available resources and all appropriate means, that includes legislative and other measures, to ensure adequate housing for all, and it's met at quite a high standard for a wealthy nation like Canada. It also requires that Canada prioritize investments and target those who are in greatest need with an aim of progressively realizing the right to housing in the shortest possible time using clear targets, timelines, and monitoring processes to track progress. The right to housing that's outlined in the National Housing Strategy Act and international law recognizes that people are entitled to adequate housing. Adequate housing means housing that is secure, affordable, accessible, habitable, culturally adequate, and well-located housing with necessary infrastructure. And that's required to live a life of dignity, well-being, and opportunity. A rights-based approach to housing also requires that housing decisions, policies, and investments all be rooted deeply in meaningful engagement with affected communities, in particular people with lived or living experience of homelessness or inadequate housing, alongside human rights experts, advocates, and civil society. As you've heard from my colleagues today, housing and mental health and substance use health are deeply and inextricably linked, as are the right to health and the right to housing. Access to safe, reliable, and affordable housing is a social determinant of mental health as it creates safe and stable environments which lead to greater well-being and improved health outcomes. Canada has a chronic shortage of stable, affordable homes, and millions of Canadians are in core housing need. This is, of course, compounded by the discrimination on the basis of disability that people face at every turn when accessing housing that's based on mental health and use of substances. The federal government has recognized housing as a human right and committed to the elimination of chronic homelessness by 2028. And there have been some investments at a federal, provincial, and municipal level. But there is so much more work to be done to ensure that the National Housing Strategy genuinely meets the needs of people who are in core housing need and ends chronic homelessness. And too many Canadians are living in unstable, unaffordable housing, and Canada has a shortage of stable, affordable homes. For people with serious mental health illness and substance use health concerns, staying housed and getting well requires supports like addictions counseling, case management, and employment assistance. Today, we are joining this coalition because Canada is in the midst of a housing crisis, and those who need mental health and substance use health supports bear the brunt of that crisis. Partners and colleagues within our network have long been calling for investments in land housing acquisition to increase public and non-market housing stock that meets people where they are with sufficiently resourced wraparound supports. Today, we join our partners in calling for new programs under Canada's National Housing Strategy, including a new 10-year investment for the dedicated acquisition, conversion, and construction of 10,000 supportive housing units, and a new multi-year funding stream for community-based organizations to cover operational support costs for supportive housing units as outlined in the campaign today. Thank you very much, and I will now pass the microphone over to my colleague, Margaret.
Thank you so much, Michelle and Marion and Leora and Debbie, for your powerful and thoughtful words on the importance of universal mental health care for us all. That would include a mental health transfer, an act for mental health, support for income and employment, and support for housing for those with severe mental illness. All of these things are essential if we are going to create the Canada that we all want to live in, that provides true universal mental health care. And with that, I turn it back to you, Catherine.
Thank you very much. So we'll pass to questions. I'll ask for people on Zoom to please use the raised hand function if ever you do have a question, so I can unmute you. Otherwise, was there a question in the room? You're good. Okay. All right, I'm just going to give a minute here for the person, for the people on Zoom. Okay. While that is happening, I do have a question. I'm just going to put my reporter cap on. You know, I'm here, so I might as well ask a question. I wanted to know if you had any discussions until now with the federal government about this this amount in the next budget and what that would look like.
CMHA National has submitted to the pre-budget process outlining our request that the mental health transfer be included in this coming year's budget. We've also had conversations with Minister Bennett, and we've been told that the mental health transfer is a priority, but at this point they are waiting on other pieces that they're working on, such as mental health standards. And we don't believe that we can really wait. We believe that standards could be worked on at the very same time as a mental health transfer was implemented. So we would like to see more urgency from the federal government. This was a budget promise made in the last election. It's in the minister's mandate letter, and we want to see action.
And you know, we also saw those negotiations happening with the provinces. We know some provinces are quite reluctant to have any strings attached to any sort of money in health. So I was just wondering if you could talk to that, and you know, is it strictly the federal government's fault, or is there a bit of the provinces in there?
Yeah, we really believe that this money needs to be ring-fenced to ensure that it goes towards mental health. And while we understand the Premier's wanting 100% control over that funding, we would push back to say that the mental health crisis is so urgent that we need to ensure that funding goes to the people that need it the most. We know that there's real stigma around mental health and investment in mental health. And so we urge the federal government to take leadership to ensure that that money is directed where it's best needed for mental health care.
One last chance for the people on Zoom. Use the raise hand function if you do have a question. Otherwise, that concludes our press conference. Thank you very much for being here and for your message, and wishing you a lovely day. Thank you.